case 4, which is nose bleeding. Now nose bleeding generally it occurs in extremely high temperatures, or if a person fell down on his nose, or if he has an head injury, or if a person has a high blood pressure. That is also when nose bleeding takes place. So how would you treat a person with nose bleeding? This is an important question asked by the surveyors. So usually people are giving really wrong answers. That is, you make him lie backwards, and that's the wrong answer. Don't ever give that answer. The right answer is the casualty should be sit with his head over a wash basin or a bowl. Okay, make him sit comfortably over a wash basin or a bowl, and let the blood drain. Okay. The next point is you have to pinch he has to pinch his nose. Okay. So the casualty should sit with his head over a wash basin or a bowl while pinching the soft part of his nose firmly for 10 minutes. So this is the soft part. He has to pinch it firmly for 10 minutes. Okay. And he should then release the pressure slowly after 10 minutes. And in case the blood does not stop, then he should repeat it for further 10 minutes. And if it still doesn't stop, he has to repeat it for another 10 minutes. So he has to do this thrice. And after half an hour still, if the blood is not stopping, then it is necessary to pack the nose with ribbon gauze. Okay. So we'll do it thrice. So first 10 minutes, second 10 minutes, and third 10 minutes. That is equal to 30 minutes. That is your half an hour. And if the bleeding has not stopped after half an hour, it might be necessary to pack the nose with ribbon gauze. Okay. And so this is the procedure what you have to follow for nose bleeding, and this is how we will treat a person with nose bleeding. Coming to our next topic, which is a very important topic, and this is also an important question asked by surveyors, which is what are the types of fractures. So the types of fractures are as follows. Number 1 is green stick fracture. Number 2, simple fracture. Number 3, compound fracture. Number 4, complicated fracture. Number 5 is impact fracture. Now what is green stick fracture? Now green stick fracture, this is a fracture. It occurs in children. In this, the bone doesn't break. Okay, only the bending of a bone takes place, or generally a crack is present in the bone. So that is green stick fracture. In adults, the green stick fracture is known as hairline fracture. Okay. Then comes your second fracture, which is simple fracture. In simple fracture is your simple fracture, a single bone breaks. That is your simple fracture, and no external doesn't cause any damage to any other parts, or doesn't cause that is simple fracture. Just a simple fracture that happened, a simple breaking of a bone. Then comes compound fracture. Compound fracture is also known as open fracture. Okay. Now this is the chipped end of the bone out of the intact. Okay. What happens is there is a wound at or near the break, or at or near the end. So in compound fracture, the bone will make an opening through the skin. Okay, when the crack takes place, the bone also comes out. So that is compound fracture. Complicated fracture happens, a single bone is broken in multiple areas. A single bone is broken. That is your complicated fracture. Also in complicated fracture, the other parts get damaged, like injury to nearby muscle, blood vessels, nerves, and internal organs. So this is what happens in complicated fracture. Then impact fracture. Impact fracture is when bone fragments is driven into another bone. Okay, a bone fragment is driven into another bone. That is impact fracture. These things will become clear once you look at the pics after this slide. Our next topic under medical first aid is regarding burns. The 3 important questions asked by the surveyors are as follows. What are the types of burns? Then what is the rule of 9? And how are you going to treat a patient with first degree burn, second degree, or third degree burn? So these are few questions, and the answers are as follows. Now the burns are of 3 types: first degree, second degree, third degree. Now first degree burns are the burns in which the upper layer of the skin gets damaged due to the burn, in which redness, there is a redness of skin, then mild swelling happens, and there is pain present. So these type of burns are called your first degree burns. Now second degree burns are burns in which further layer, your dermis layer, gets damaged, and in this much more redness of the skin takes place, and more severe swelling is present, and there is severe pain as the damage is till the nerve ending. Okay, it's near the nerve endings, so till there the damage happens due to the burns, and hence the pain is quite severe. Formation of blisters take place over here, and in this case, how are you going to treat such a patient? You give him antibiotics, you give him a tetanus injection, and if the blisters are big, then you burst them, and if the blisters contain blood or pus, then you burst them, clean it, and do the dressing. This is what you do in second degree burn. Now third degree burns are much more severe than degree 1 and degree 2. In this, the whole skin layer gets damaged due to the burn, and the destruction of the nerve ending happens over here, due to which there is no pain present. Okay, this is a very severe burn. And then comes the rule of 9. Now in rule of 9, how are you going to we say no, the person has 15% burns, 18% burns. So how do we calculate the percentage of burns is as follows. Now your head and your neck comprise of 9%, your arms comprise of 9%, your upper middle body comprises of 9%, lower middle body comprises of 9% burn, genitals comprise of 1%, your upper legs comprise of 9% each side, as you can see in the figure over here. Then if the burn is more than 15%, the patient may go into shock and need to be given more fluids. Now what kind of fluid loss takes place while burns happen? So there is this fluid called as plasma, which is present in your blood. The loss of this fluid results in person going into shock. So for that we give him fluids in order to recover much faster. Then if more than 20% burn is present, then IV fluids to be given mandatory. Also get him evacuated. So this is a requirement which has to be fulfilled. Then how much of the fluids are you supposed to give? So the calculation is as follows. Now the ml of fluids to be given in 24 hours is to be calculated as with this formula, which is 4 into body weight in kg into percentage of burn. Okay, and half of this amount is to be given in the first 8 hours, and half of it is to be given in the next 16 hours. Or else you can give rectal fluids. Check the IMDG supplement, and as under appendix 13 it is present on how to give rectal fluids by using rectal canisters. So this is how you will be giving the fluids. IV fluids are nothing but it is intravenous fluids what you give. So this is how we are going to treat a person with burns. So friends, treatment for burns are as follows. For first degree burn, what you will do is you will soak the wound in cool water for 5 minutes or longer. Then you will take ibuprofen for pain relief. Then applying antibiotic ointment or aloe vera gel cream to soothe the skin. This is what we will do in first degree burn. In second degree burn, wash your hands before cleaning a burn. Take appropriate precautions as the open blisters can easily be infected. Hence take proper measures, that are wear proper gloves, and then gently wash the burn area with clean water. Apply the ointment, and you can also do dressing. Then taking ibuprofen for pain relief, and you can also give TT injections in both the cases. Then comes your third degree burn. Now third degree burn, in this you have to take radiomedical advice, and early cleaning and debriding to be done. Debriding is nothing but removing the dead skin and tissue from the burned area. That is what debriding is. Then start IV fluids, your intravenous fluids. Now IV fluids are those which are containing electrolytes. So that's what you have to start. Then apply the antibiotic cream. Also give need not give ibuprofen as there is no pain over here in third degree burn. You can give TT injections so that infection doesn't take place. Now when all you will seek radiomedical advice. Now radiomedical advice should be taken during third degree burns, especially those encircling the chest and limb area. Then burns in babies. Then burns of face and genital, and large burns around your joints. Then burns over 18% of the body surface in adults and 10% of the body surface in children and older persons. So this is when medical advice is a must to be taken. So these are the treatments for burns.